Hi, my name is Natalie. I am an occupational therapist and a pelvic floor therapist, and I'm going to continue the series about why you might go to a pelvic floor therapist. Today is going to be a little bit less symptom or functional specific and more just, do you need pelvic floor therapy if you've had a baby or haven't had a baby? Because that kind of has been coming up in the discussion on my last post. The short answer is it doesn't necessarily matter if you've had a baby or even if you're a male or female and what your anatomy is. Everybody has a pelvic floor, and I brought my little model to show a little bit of what I'm talking about. So in this model, this is female anatomy. It's not exactly anatomically correct. Everything is kind of swimming around. But if you were to take out the three main organs that are kind of sitting in this little area, so you have the bladder, you have the uterus, and then you have the colon, the intestines, all that kind of stuff. The uterus is one of those things, and yes, having a baby makes it expand and then go back down into place, which does put pressure on all of this. But there's a lot of other things that cause pressure too, and having a baby is not the only reason for causing issues in the pelvic floor. Also, when we talk about the pelvic floor, we are not only talking about the uterus, and I think that's just a lot of misinformation out there. It's not your fault if that's what you thought. I thought the same thing until I got this training and did all of the work that I do. Yes, it is part of it, but it's not the only part. The pelvic floor is actually talking about all of these muscles and bones and all the things combined to make this sort of a bowl shape at the bottom of your pelvis. So literally it is the floor or the basement of your pelvis. So this whole thing being the pelvis, right? Here's your tailbone, the hips, the bones in the front. At the bottom, there's something to hold you up so that things don't all fall out. Now that can be holding up the uterus, which gets heavier and bigger and, all the things when you're growing a baby. But also the colon and your entire bowel system can get swollen and have issues. Your bladder can have issues. There's post-surgery things. There's all kinds of stuff that can cause symptoms that are not just related to the uterus. Also, a big, I think, piece of misinformation out there is that if you have a C-section, you don't have to have pelvic floor therapy. While it is true that, yes, the baby coming out of the vaginal canal would cause pressures in that area, again, it is not the only part of the pelvic floor that could cause issues. So maybe that one area is causing people issues, and that can totally be the case. But also just growing a baby in general in this space pushes organs around, it stretches things out, it might give pressures in different areas. So having a C-section is not a reason to not need pelvic floor therapy. In fact, I've had 2 C-sections, and I wish I had pelvic floor therapy. Now I'm working on myself. So hopefully that clears things up a little bit. I know it's super confusing. It's a very hidden area. It's not something that we're working on like bicep strengthening or coordination, right? So it's very confusing of what we're even talking about. There were questions about if you've had a hysterectomy and now you have a cuff, do I no longer need pelvic floor therapy? Not necessarily, because again, that's just one piece of the puzzle. That's not speaking to the entire pelvic floor. That's just speaking to one part of the vagina and the uterus. So you could be having issues in other places, or you might have the cuff and be completely fine. I'm biased and I kind of tell everybody, like pretty much everybody could probably benefit from pelvic floor therapy, men and women. But if you are noticing symptoms, issues that are affecting your day-to-day function, then I would definitely reach out to a pelvic floor therapist. Remember, that can be an occupational therapist or physical therapist. Pelvic floor therapist is the post-grad training that we get, the specialty training that we get, but we can be either type of therapist. So if you are having issues, whether or not you've had a baby, whether or not you've had a C-section or a vaginal delivery, whether or not you're a male or female with male or female anatomy, every human being has a pelvic floor. It's just a matter of whether or not that pelvic floor is coordinated, whether you're managing the pressures internally well, and it's not your fault if you're not. We just have to learn and get our body to be more coordinated. It is whether or not things are affecting your daily life and your function and allowing you to participate fully in your life. And that is when you can get pelvic floor therapy.